Thank you and good afternoon, everybody. We have some important updates for you this afternoon, and so let me get right to that information. So I've been speaking to all of you now for about the past week and a half about the pandemic and its effect on the St. Louis metropolitan area. And I personally want to thank everybody out in the community for all the incredible work that you've done across the entire metropolitan area. You've really rallied together to put the hammer down on the virus, and for that I thank you. We've received a lot of questions as well about how are we doing overall in the fight against COVID-19. And people understandably have questions about whether social distancing is working, how long will it be necessary, and will there be a second wave of the virus. So today is a good day for us to step back and take stock of where we are and where we're going, and also share with you some of the insights that myself, the other chief medical officers from the other major healthcare systems, the epidemiologists that we work with, and the data scientists on what we're seeing and what we think is going to happen going into the future. But first I want to underscore that we're still on the steep part of the curve. There's no doubt about that, and that we need to continue those efforts to continue to bring the hammer down on the virus, and we need to continue these efforts for some period of time going forward. So I think this chart here will really help show what is occurring out in the community, and it makes it a little bit more clear when I'm talking about that steep part of the curve. When I first reported our census numbers back what seems like eons ago, but it was just on April 5th, we had 468 patients that were hospitalized with COVID-19 or were suspected of the infection. Yesterday, as you know, that number was more than 700. This was an increase of over 50% in less than 10 days. So the spread of the pandemic is quite real, and it's growing. And we all have to do everything that we can to decrease the spread, which will in turn help save lives. So I've continued to update you on those numbers of COVID patients in our intensive care units and patients on ventilators as well. And as you know, those numbers have increased along with those hospitalization numbers. Now, as you can see, today's COVID numbers continue that trend. We've had 707 hospitalizations today, which is up from 702 yesterday. We have 175 ICU patients, which is down slightly from 185 yesterday. And we have 149 patients on ventilators, which is about the same as yesterday, where we had 145. On the good news side, we discharged 59 COVID patients yesterday, so that is good news. But these data really underscore why we have to continue to examine our trends over time and not necessarily be caught up in day-to-day fluctuations. The surge is real, it is continuing, and we have to do all that we can to stop the spread. Now, I'm also often asked about when are we going to peak here in St. Louis and what that might look like. And my colleagues, as I mentioned, from BJC, Mercy, St. Luke's, and I have looked at this, and I can provide you some updates on those dates and on those numbers. But as I've said before, forecasting for pandemics is a lot like forecasting for hurricanes. We have good information on where the hurricane is or where the pandemic is, but as we go farther out into the future, it becomes much more uncertain on where it's going to land. And the same is true for forecasting for a pandemic. You have a lot more uncertainty the farther out you go from where the pandemic actually is. So early on in the pandemic, we relied on data from other communities to help us understand what was it going to look like when it landed here in St. Louis. But as we've gathered more data on the ground, as the healthcare institutions have brought more data into the model, we've become much more precise about what we think is going to happen to the St. Louis metropolitan area. And we've run our models again last week, and now I'd like to show you some of the data that's come out of that. So based on our latest modeling, we believe that around 71,000 people will have been infected with the coronavirus in the St. Louis area at the end of April. Now that's down slightly from the number that we've been using in the past, which was around 80,000. And that's really a reflection of all of the good things that we've been doing out in the community. And that includes things like sheltering in place, social distancing, hand washing, keeping surfaces clean. All of those things have brought that estimate down. And just to remind everybody, this is an estimate of number of infected people. So this includes those people that are asymptomatic or don't have any symptoms but were still infected, people with mild symptoms that never went and got tested, and people that did go and get tested and became positive, and all, of course, those patients that have been hospitalized. And as you can see, it's still a significant number for our metropolitan area. Now we know that a lot of, or some of those people will be hospitalized, and some will have severe and even critical symptoms. And so we have to do everything that we can in order to continue to decrease that number. And we've done a good job up until now, and we need to continue doing that good job. Now let me move a little bit more to our updated models on a couple of other data points. And so let me explain the lines that you're going to see on this graph a little bit more. So the gold line that you see there is what we call our worst case scenario. So that's if we didn't practice any social distancing, and if things had really gone wrong, that's what we would have predicted really being a worst case. And the white line is what we believe is the most likely case, though. And so that's the more accurate prediction using real-time data that we're observing here in the St. Louis metropolitan area, and then doing our best assumptions on where we think the virus is going, what the spread is like in the community, and then being able to predict those numbers. And then the blue line there is our actual data. And so I want to point a couple of things out. So first off, we're predicting that the peak, or the highest number of cases that we believe are going to occur in the metropolitan area, will occur on or around April 25th. And so that's for the total number of hospitalizations. And that number will be anywhere between 600 and 700. For our ICU status, it's a little bit of a different range. We think it'll be anywhere from April 21st through the 24th. And that number will be around 170 to 180 patients. But the thing I wanted to really point out on this graph is if you follow that blue line and look at the dates, you can see where St. Louis was actually trending along a worst case scenario. And if you backtrack, because it takes a little bit of time for the virus to spread, to incubate before it causes symptoms, and then you get hospitalized. So hospitalization is really further into when the spread is occurring. There's a time lag to it. And so if you look back in time to when we started practicing all of the social distancing, the shelter in place, all of those things, and then you look forward, so counting incubation time, how much time it takes to develop symptoms, all of those things, you'll see a deviation in the curve where it goes from worst case to most likely. And that is a result of all of those things we put in place a couple of weeks earlier. So it's really important to understand that the measures that we've put in place are having an effect. And they are what is known as bending the curve. That is the bend in the curve. So we're getting closer to the most likely case. And much of that is attributed to all of those social distancing, shelter in place, all of those other things that we've been practicing. What we don't want to do is to be tracking up to the gold line. And so as you can imagine, if we had not put all of those things in place, we'd be having a much different conversation now, where we would be continuing to track on the gold line, where if we hadn't done all of those things, those cases could have easily reached up to 1,000 cases by now and completely overwhelmed our healthcare systems. And so again, I want to thank everybody out in the community, our elected leaders, everybody, for taking this seriously early on and practicing all of those social distancing rules, everything to really bring that curve down. It has paid off, but we can't let up now. And so that is always the challenge. Is we're starting to see the benefits of all of those practices that we put in place, and they are helping keep the pressure down on that curve. But we are still operating at crisis standards of care in our hospitals. We are still challenged with personal protective equipment. Our healthcare workers are still stressed because of all of the cases that we are seeing. And as I mentioned, about 10 days from now, we are continuing to see this high level of cases throughout our communities. And so we can't let up now. Another thing that I want to discuss is so then, what does this look like going forward? As I said, it takes weeks for these cases to develop. And so when it comes to when can we start relaxing social distancing, when can we start relaxing all of these other measures, it's still going to take some time before we can even begin to have discussions about what does that look like. There are other things that we have to consider before we can even start thinking about taking some of those measures and relaxing them. And so one way to really sort of define that is to take a look at what has happened in the past. And so you've heard me talk about the 1918 pandemic and the St. Louis versus the Philadelphia story. So, and we've rightfully earned our place in history for handling pandemics in the past. And so these two curves here show what happens when you do very aggressive social distancing and shelter in place, comparing the two cities. So St. Louis in 1918 took very aggressive steps where Philadelphia did not. And you can see those initial parts of the curve where the deaths in St. Louis were significantly less than Philadelphia. However, over time, we became comfortable with that low rate of infectivity, and we began to relax our social distancing rules and our shelter in place. And what is not discussed as much as that second wave of the 1918 influenza, which actually was higher than the first wave and caused more deaths in St. Louis than initially. And that is rightfully attributed to relaxing of social distancing and the shelter-in-place orders. And so that's exactly what we don't want to happen in this pandemic, is to relax too fast, too soon, and create a second wave which would ultimately overrun our healthcare systems and cause a lot of death. And again, just to reiterate that point even further, these viruses, and I'm comparing this again to the 1918 pandemic, they typically come in waves. And so as you can see, the second and the third waves in the 1918 influenza pandemic actually caused more deaths than the initial wave. And so I don't want us to be lulled into this false sense of security that if we can get over the first wave of infections, that it will be clear sailing going forward, because that's just not true. We have to be very cognizant of the fact that the virus is still out there, that it's still circulating, that can still cause infections, still cause death, even if we are blunting the curve. We have to be very prescriptive about how do we relax the social distancing and all of the other precautions that we've put in place. Because the last thing that we want to happen is to end up with a second wave, which is much larger than the first. And we can do this. We can think about this. We can build systems. We can develop a really good policy to ease our way back into what is considered normal without having the second wave. But it's going to take cooperation of everybody in the community, not just the healthcare sector, but also the business sector, the public health sector, our elected officials, and everybody to understand that this is what we're trying to avoid. Everybody certainly wants to get back to normal. I personally would love to get back to normal. But I don't want us to suffer on the back end because of a rush to get back to normal too fast, too soon on the front end. And so those are just some stories that I wanted to share with everybody to reiterate the fact that, yes, we're doing a good job. We are. There is no doubt that we're doing a good job. And St. Louis, again, is showing the rest of the country how to deal with a pandemic. But let's not make those mistakes of the past and end up with the results of the past because we've moved too fast, too soon. And with that, I think I'd be happy to take some questions from the media.
When should governments in the area relax restrictions on business closures or shelter-in-place orders?
So that's a question that's asked quite frequently, and so I'll answer it this way. I really, in looking at the data, and you all have seen the graphs that I just presented, I do not believe that we can even consider relaxing some of these rules until the middle of May. Now, let me put it a different way, though. So people get really fixated or really want to pin their hopes to a date. And that's understandable. But this is the real question, is what sort of strategy do we have in place in order to ensure success once we do back off of social isolation and distancing and things like that? And that needs a couple of things to happen. First, we have to really build a robust testing and tracing strategy. And so what that means is we have to understand, well, what is the prevalence of disease in our communities right now? Do we have enough testing capability? And I've talked a little bit about the differences between the different types of testing. And do we have a robust public health a strategy so that we can do adequate tracing, quarantine, and isolation? Remember, the only way to stop spread is to decrease transmission. And so unless you have those systems in place in order to decrease transmission, it doesn't matter if we relax social isolation tomorrow or in 2 weeks. We have to have those systems in place in order to be successful for once we do decide to relax those rules.
When can or should local economies start opening back up?
So that's sort of the same answer. It's not so much a date. It is, when do we feel confident that we have strategies in place so that we can start easing up? And again, this won't be like a light switch where we flip it on and everything goes back to normal. That would be foolish. It's more, and I think you heard me talk about this yesterday, it's more like a dimmer switch where we turn it on a little bit, see what's going on out in the community, understand where we are with the virus, and then adjust from there. And so we have to have those specific strategies in place so that we can gradually turn on the economy and not just turn it on full bore.
Even if restrictions continue for another month, what are the projections for deaths and infections?
So we don't have projections for deaths. And I think I showed the projected infections for the month of April at 71,000. So as we run the models every week, we get a little bit better idea on what we think the total number of infections will be. And so as we do that, we'll refine the numbers and we'll report them back out on total number of infections.
Is Missouri or the greater St. Louis region starting to emerge as a hot spot for infection? And if so, how did that happen?
I have not seen anything that would indicate Missouri is a hot spot. And I think I keep up pretty well in the media, so I haven't seen anything that says that. We have, though, emerged from being a leader from a couple of weeks ago further down the list of major metropolitan areas where the virus spread is. And that's directly attributable to the social distancing rules, shelter-in-place rules that we put in place, and the effort of the community. I don't want to, understate that it's really been a collective community effort that's really brought that rate down. But we've been very successful in bringing that rate down. Now the challenge is we need to continue it and then develop a really good strategy for how we can emerge from this thing on the backside without having all of those unintended consequences from moving too fast.
How do your current models for hospitalizations compare to the previous models that were shared a number of, about 10 days or so ago?
So the models get tweaked every time we run them. And that is because we get more data coming in. And so we're able to take that data and then feed it into the model. And so just like using my hurricane analogy, as the pandemic continues its spread across our region, it's not really across our region, it's how it spreads within our region, we get more fidelity in our projections. And so In terms of absolute numbers, though, from the models that we ran a week ago to the models we just ran last Friday, the projections have come down. And so, as you remember, last week or week and a half ago, I said that it could be anywhere from around 1,700 to 3,000 patients, or 1,300 to 3,000 patients. And those numbers have cut down considerably, almost in half. And that is because as we get more data and we can understand what spread is going on out in the community, those are all inputs into the model, then it calculates different numbers. And so it's not surprising to me that those numbers have come down. And again, that's because of the success we've had in our community with all of those preventive efforts. So it's not surprising that they've come down, but we'll learn more this week when we run our models again.
You provided estimates for both the best case and worst case for hospitalizations and ICU patients. In each of those scenarios, what is the estimate for the number of ventilators that would be in use at the peak?
So the numbers that we use, so we don't necessarily have that specific number for ventilators, but in general, we know that around 30% of hospitalized patients are going to be in the ICU. And of those 30%, 70% of that number typically end up being on a ventilator. Now, one of the things that we are seeing, though, is we are seeing a slight decrease in ventilator and even ICU utilization, which is a good thing. And that's one of the benefits of extending the curve out as well, as we can let medical science catch up to us. And so as we're slowing the curve down, we're also learning from places like New York and New Orleans and Seattle, where clinicians have tried different therapies. And so when we incorporate those then into how we take care of our patients, we're benefiting from their experiences from a week, 2 weeks ago. And so some of the therapies that we are trying have helped us decrease those number of patients going into the ICUs and decreasing the number of patients going on to ventilators. So that number will probably change.
How many ventilators do task force hospitals have in the region? And were any of those sourced from outside of the region in response to this pandemic, or did any come from the national stockpile?
On any given day, we have around 900 ventilators within our St. Louis region. And the reason why you can't be precise with that is ventilators are machines, and so they require maintenance. Sometimes they break, all of these other things. But in general, we have around 900. Now, I'm not aware of any ventilators that we have from the Strategic National Stockpile. And I've been talking with the emergency operations centers, and they ask us if we need any from the SNS. But the way that you process requesting them, you have to show need. And right now, we've been very fortunate where we don't have to show need because we're keeping up with demand right now.
Do you see any need for additional alternative care sites outside of the Florissant Hotel?
Right now, and I'll stress right now, we seem to be doing fairly well with taking care of patients within our facilities. So you've heard me talk about we're still operating under crisis standards of care. We're still seeing those numbers to continue to go up. But because of those decisions made by elected officials and the community doing their part, you've also seen that the curve has been continuing to flatten. And what that translates into then is our healthcare systems are able to handle the patient load that is coming into our facilities. And what that translates into is less of a demand for those alternative care sites. So as of this point, we don't see the need for additional alternative care sites. But certainly I'm in contact with the National Guard and SEMA, and they certainly have said, if you need them, please contact us and we'll get to work on them right away.
That concludes the questions that have been received at this time by the Task Force Public Information Team. If additional inquiries are received after the briefing concludes, we will attempt to respond to those as quickly as possible this afternoon. Otherwise, we'll begin to accept questions tomorrow morning for tomorrow afternoon's Task Force live stream. Thank you for tuning in.